Hey there, do you know that 1 in 160 children have autism spectrum disorder, also known as ASD? Autism spectrum disorder consists of a broad range of conditions. ASD is characterized by challenge with social skills, repetitive behaviors, speech and nonverbal communication. Due to all these challenges they are facing, people with ASD may communicate, interact, behave, and learn differently from other people. Because autism is a spectrum disorder, each individual with autism has a distinct set of strengths and faces different challenges. Therefore, the ways that people with autism learn, think, and even problem solving can range from highly skilled to severely challenged. As a result, some people with ASD may require significant support in their life, while others may need lesser support or even live independently. The exact causes of ASD is unknown. However, ASD can be due to environmental, biologic, and genetic factors. Genetic factors are one of the risk factors that can make a person more likely to develop ASD. The most common causes and risk factors of ASD include having older parents, having a sibling with ASD, very low birth weight, valproic acid, and thalidomide consumption during pregnancy, and genetic conditions like Down syndrome, Fragile X syndrome, and Rett syndrome. People with ASD often have problems with social, emotional, and communication skills. They might repeat certain behaviors and might not want change in their daily life. As suggested, most people with ASD also have different ways of learning, paying attention, or reacting to things. The signs and symptoms of ASD can be classified into social communication or interaction behaviors and restrictive or repetitive behaviors. Social communication or interaction behaviors include little or inconsistent eye contact, reluctant to look at or listen to people, rarely share enjoyment of objects or activities, slow or do not respond to someone calling them or any verbal attempt to gain attention, difficulties in holding a conversation, talking about their favorite subject without noticing others are not interested in them, facial expression, movement, and gestures that do not match what is being said, unusual tone of voice, having trouble understanding another person's point of view. On the other hand, restrictive or repetitive behaviors include repeating certain behaviors or having unusual behaviors, having a lasting, intense interest in certain topics, having overly focused interests, getting upset by sharp change in a routine, being more or less sensitive to other people to sensory input. ASD can be diagnosed by observing the person's behavior and development. ASD can usually be reliably diagnosed by the age of 2. It is important for those with concerns to seek out assessment as soon as possible so that a diagnosis can be made and treatment can begin. Diagnosis of ASD now includes several conditions that used to be diagnosed separately. The treatment or therapy for ASD should begin as soon as the individual has been diagnosed. Due to the wide range of issues facing people with ASD, there is no single best treatment for ASD. Early intervention services are able to help children from birth to 3 years old to develop important skills. Behavioral, psychological, and educational therapy is another form of treatment. Programs like these are typically highly structured and intensive and may involve parents, siblings, and other family members. A doctor may use medication to treat some symptoms that are common with ASD. With medication, a person with ASD may have physical problems with irritability, aggression, repetitive behavior, hyperactivity, attention problems, anxiety, and depression. That's all for now. Thank you.